I'm Dr. Bruce Perler. I'm the Julius H. Jacobson Professor of Surgery at the Johns Hopkins University School of Medicine and Chief of Vascular Surgery and Endovascular Therapy at the Johns Hopkins Medical Institutions. I'm a vascular surgeon. Vascular surgery involves the diagnosis and treatment of the entire spectrum of circulatory disease, including aortic aneurysms, cerebrovascular disease, stroke prevention, carotid artery disease, as well as PAD or peripheral arterial disease, blockages of the leg arteries resulting in pain with walking, or more seriously, non-healing ulcers or gangrene and limb salvage. We also take care of veins and venous insufficiency and lymphatic disease. In many respects, the term vascular surgeon is a misnomer because as a vascular surgeon, I do much more than surgery. We're intimately involved in the diagnosis of patients with circulatory disease, often using non-invasive laboratory techniques. A large part of my practice involves the medical therapy of patients with vascular disease. We do open surgical procedures, as we always have done, but today about 70 to 80% of patients who require intervention undergo angioplasty or stent procedures. As a comprehensive vascular specialty, vascular surgeons really provide all the tools in the toolbox. And really, when a patient sees a vascular surgeon who does everything, medical management, endovascular therapy, and open surgery, only then will that patient be guaranteed they're going to get the treatment specific to their condition, and not just one particular treatment that a particular specialist offers. Interestingly enough, I initially wanted to be a heart surgeon and accepted a position in a cardiac surgery residency. But as I thought about it, I decided I'd rather take care of vascular disease all over the body. Working at Johns Hopkins as part of the Heart and Vascular Institute, it's the best of both worlds. A lot of my patients have heart conditions, and so on a regular basis, I have an opportunity to work with cardiologists and cardiac surgeons in a very collaborative fashion. My research is in clinical outcome studies, which I think is becoming increasingly important today with rising healthcare costs and with great pressure on clinicians to control healthcare spending. Clinical outcomes research tries to assess the relative value of various approaches to treat a specific problem, to identify not only the most clinically effective, but the most cost-effective ways to treat patients. I guess if I were asked to describe my philosophy of patient care, I'm cognizant of the fact that working at Johns Hopkins, a referral center, a tertiary referral center, when the patient leaves my clinic or when the patient leaves the hospital, they're going home to their community and they're going to be cared for by their primary care physician. So I see my role largely as partnering with the patient's primary care physicians and working collaboratively with them to really optimize our patients' clinical outcomes. And the real beauty of working at Johns Hopkins is we collaborate with so many specialists across different specialty lines with cardiac surgery and cardiology and intervention radiology to really bring the best of all of our respective fields to the care of any individual patient.